How hard is a substantial kind of reform going to be versus tweaking on the edges?
It's going to be extremely difficult because healthcare is so complicated. There's so many different parts that all fit together, and we're going to have to. The Republicans are going to have to, if they want to do it right, they're going to have to recognize that.
Well, you tried to bring together, the Democratic caucus and even Republicans as well back in, 2008, 2009, 2010 when you guys were working on this bill. I mean, give us a sense of how challenging that process was and what we can know about what the Republicans are going to have to go through now if they want to try to actually do any kind of repeal and replace package.
Big lesson here, frankly, is that when it gets political, you got problems.
And it's political now.
And it got political back then.
Yeah.
Don't forget, we were working together for 2 years. And at the end, the Republican Party saw the politics of it rather than the policy, and not one Republican voted for it. And when that happens, you don't have buy-in, sufficient buy-in for the Congress and the country. That means it's unsustainable. So if the Republicans try to do the same thing again, that too is going to be unsustainable, especially if they're going to cut back coverage and health insurance from so many people. That's going to cause a lot of people at these town meetings to be even more outrageous.
Now, Trump has said basically, and this will sound familiar to you as well, we're going to cover more people. It's going to be less expensive, and the health care is going to be better. Is that possible to do?
Well, he's Trump. He has the magic words, but practically no.
Yeah.
I was struck, though, by Representative Walker's comments yesterday, because is this an issue that you're going to have Democrats and the far right actually agreeing on and not being happy with the repeal?
Well, but far right doesn't want to increase the budget deficit.
Right.
That's the main problem there. And Democrats don't want reduced coverage. Look, we're supposed to be working for the American people. The American people want health insurance. They want us to find some way to cut down costs. We spend twice as much per capita on health care in the United States than the next most expensive country. And we got to address ways to reduce those costs. And the way you do it, in my judgment, is more efficiencies on the programs, but also reimburse more on the basis of outcomes and quality rather than number of procedures.
Well, I was going to ask, Senator, we're kind of in the big hopes moment of this thing early on in a new Congress and everything like that, and reality is beginning to set in on the political difficulties here. Presuming that they do something, what does that look like, and what does Obamacare look like, or maybe it'll be rebranded Trump Care in a couple of years? I mean, what does that look like 2 years from now when this process is, at least in this iteration, done? Well,
based upon what I see right now, it's going to be a mess because 20 million people are not going to have health insurance. They were added in under ACA. You're going to find problems getting even worse yet with the repeal of the so-called individual mandate and the employer's mandate. There's going to be a death spiral. That is, that premiums are going to go up because the insurance is going to tend to cover the sicker rather than the healthier. It's going to be a mess. So if what I see is enacted.
If you were back in your old job, you had a chance to fix one thing in Obamacare. Now that you know it, what would you fix?
I would, first of all, I would not cut down coverage. The thing I would fix is reimbursement, so it's based much more on outcomes and quality health care rather than the number of procedures.
And would that save money?
It'll save money.
How much?
I don't know. I don't have a figure, but I know it's the right approach, the right thing to do.
And where do you think, is it, when you look at the tax proposal by the Republicans out there, does that remind you of the Cadillac tax in a way? It does.
Cadillac tax comes back very often, that's true. For those who don't know, the Cadillac tax is saying, okay, but some of the very, very expensive of policies, they're too expensive, so you got to pay a tax on those. So
timeline of August, not realistic?
I think that's not realistic. Oh, don't forget. The world is run by deadlines, and things tend to get shoved up to the deadlines. The next deadline is going to be probably next year.